Hello everyone, welcome to sqadia.com. I'm Dr. Sanan Rahman and today we are talking about the development of tongue and the thyroid. The two topics are clumped together because the development goes side by side and they are interrelated in a way that the adult structures that are formed are actually the remnants of the structure that embryologically give rise to the tongue as well as the thyroid. So this lecture has been divided into 5 sections. The first section deals with the development of tongue in itself. In this, we'll see what are the various embryological components that give rise to various adult components of the human tongue. We'll see various swellings that develop in the area of the mouth and help in the formation of adult tongue, and we'll see what hypobranchial eminence is and what is its importance in human adults. Then in the second section we'll talk about the various parts of the tongue, that is how the tongue is divided into various parts: the anterior part, the posterior part, and the posterior most part. We'll also talk about the muscular component of the tongue, that is how various muscles that are actually a part of the tongue are developed and what is their correlation with the nerve supply. Finally, we'll talk about the anterior part of the tongue and the floor of the mouth. In the third section, we'll talk about the clinical correlates of the tongue development. In this, we'll see what goes wrong and where that give rise to various pathological scenarios which are present in the human adults when the development does not go as planned. In the fourth section, we'll be moving on to the development of thyroid. We'll see what are the sources of development of thyroid and from which embryonic structures the thyroid is actually made. We'll also talk a little about the histogenesis of the thyroid, that is what are the cellular components that help in the formation of the adult thyroid gland. In the last and final section, we'll be talking about the clinical correlates of the thyroid development. The development of thyroid and its abnormal position may give rise to the lack of normal development of thyroid and its ectopic or abnormal position may give rise to various pathologies in the adult humans that need to be discussed in this section. I hope you're excited about today's lecture. For further such lectures, keep watching sqadia.com.